Good afternoon, everybody. My name is Rob Allen. I'm a first-year OEM resident here at Hopkins. Here to introduce our next speaker. So Chia-Chia Chang is a coordinator at the National Institute for Occupational Safety and Health, Office of Total Worker Health, and the NIOSH Healthy Work Design and Wellbeing Cross-Sector Program. She collaborates with partners to share research and promising practices for advancing worker well-being and led the development of the NIOSH Worker Wellbeing Questionnaire. Chang's previous work in the NIOSH office of the director includes leading enrollment and outreach for the World Trade Center Health Program and serving as assistant portfolio coordinator for the Emergency Preparedness and Response Program. Prior to joining NIOSH, she worked on disability policy at the Social Security Administration. So I will pass it over to Chia-Chia.
Hi. I'm going to try to walk around to wake everybody up. I'm Chia-Chia. I'm very glad to be here. As he said, I used to work at SSA down in Woodlawn, so it's always nice to come back to Baltimore. Let's see. And just to explain, I'm the reason for the switch in time. I thought I was going to be late, and really thank the organizers and Albert for the flexibility in switching times. I think there is a lot of similarities in our presentation because we're talking about this total work health approach. But now we're going to sort of step back and look broadly beyond mental health issues into all the other aspects of physical health and well-being related to workers. This is sort of, we're going to start off talking about issues facing workers that are emerging and traditional. This is my actual certificate. If you're doing the math, I'll save you. I've been at NIOSH for 25 years. I'll ask how many of you think you're going to stay that long at any point? None. Things are changing. I never imagined I was going to stay that long. The current workplace is meandering. You take a scenic route. You change things a little bit. I need to stay here. You change things a little bit. You take a side hustle. You take a part-time job. You switch to do some moonlighting things. And that is the way the world is now. There's a term VUCA that is not just for work, but it certainly applies to work. Things are volatile. It's uncertain. It's complex. And I've seen the agenda for this conference the last couple of days. It's a complex world and ambiguous. And how do we, as occupational safety and health professionals, prepare for that? NIOSH a few years ago developed a future of work initiative, and then recently we launched a foresight initiative. Strategic foresight, just like it's not just for worker safety and health, it's in many disciplines. You do an environmental scan, looking at not just your traditional literature, but the more periphery literature, the things you probably wouldn't pay a lot of attention to. But you look at that and see what are the hot topics in the short term, and then in the midterm, and in a few decades from now. And based on that, we identify priorities, including mental health, of course, technology, artificial intelligence, you can imagine certainly would be hot. And also privacy, because of all that. You need data security, given all the interconnectedness of everything. And of course, partnerships and research. This is just to get across the point that things change. What is being taught in school right now, the disappointment to me in looking back over things is that all that time I spent learning, you still have to keep up, which is why you're here. Things keep changing, and we can't just say, oh, well, we figure out the top concerns for workers because new concerns pop up. An example, as Albert said, precarious employment. I'll say a little more about it beyond mental health. Of course, there's job insecurity and the impact of that on stress and mental health, but then also career development. The people who are in precarious employment are the ones who are less likely to be trained. So there's less career advancement. What does that do for their mental health? What does that do for also training in terms of safety and health? They're less likely to be trained. They're more likely to be given the more dangerous jobs. Health insurance, they're less likely to have health insurance. Again, what does that mean for their well-being? Less likely to have representation in terms of labor unions. And the populations are more likely to be at high risk. Now, of course, it can be good, in the medical field, there certainly is a lot of contract work, and these could be good, right? It gives you flexibility, autonomy, and the key is, as with many things, I think it's a common thread, as long as it's your choice. If you're choosing for, this precarious employment because you want the flexibility and autonomy, that's great. If it's not your choice and you want a full-time contract, but you can't get it, that's when the job stress comes in and other issues. Another hot topics, of course, artificial intelligence. Again, what does that mean for the workplace? If there is potential for helping, right, it could reduce some of the really repetitive, boring work, you can automate that. But then what does it mean for, again, worker privacy, surveillance? What are the concerns for that? What does it mean for mental health again? And then more hot topics, literally hot topics, climate. If it's getting hotter, what does that do for workers? And again, how can we as occupational safety and health professionals continue to keep track of the research and protect workers? And beyond that, there's also traditional hazards that have been around a long, long time. And unfortunately aren't changing, or it could be getting worse. As Albert said, working long hours, working 55 or more hours a week is associated with, I think it's a 35% increased risk of stroke and a 17% increased risk of heart disease. And that's also been linked to working long hours, 55 hours or more a week, has also been linked to increased BMI, increased waist circumference, and one study found that there was a dose response predation effect. The longer you're in these types of jobs, 1 decade versus 3 decades, the worse the health outcomes. So in addition to the new hazards, there's all these things that we still need to deal with. And the key for occupational safety and health providers would be, asking workers these questions. It's one thing to say, are you getting enough sleep? But, do we know why? If they're not, do we know why? Is it because their workplace is understaffed, so they need to work more hours? Is it because they are underpaid, so they need to take on extra jobs? So with all these organizational interventions, as Albert pointed out, upstream issues. Another traditional hazard is policies. Again, Albert talked about this, policies for leave, paid time off. Yes, in the United States, we have no mandate of paid time off. I think the most egregious example I've heard of was at a conference. I met someone from a local YMCA chapter. They worked in their local community. They get 3 hours of paid leave per pay period. That's 24, it's a 2-week pay period. So it's about 3 days vacation time a year. And what about sick leave? So they do have sick leave, I don't remember how much, but to use any sick leave, you literally need a doctor's note. Of course, we know, at least in public health, that, if you're feeling like you're getting sick, you just stay at home and not infect other people. Can you even these days in the healthcare system, can you even see a doctor without anything? So this is a concern. And what does this do for worker well-being? So again, these are things that are very multidisciplinary, moving beyond traditional medicine, but the key is we can work together with other partners, people who can have influence over these types of policies to impact worker well-being. And there's a new initiative by Us Against Alzheimer's on brain health. And I really like it because it's sort of putting a name on some of these issues. And brain health, how does it relate to work? Well, there's of course job stress, all the things that Albert talked about, the health outcomes of that, downstream effects, headaches, sleep disturbance, impaired ability to function, anxiety, depression. And of course, the impact of job stress on your health behaviors. And there's been some thought about that maybe if you're sort of stressed at work or you don't have a lot of control over your job at work, maybe that lack of empowerment carries over into your personal life. you don't have any control at your job, so then you think there's not much you can do about your own personal health too. Or, you're so obviously tired from work that you don't have the energy or mental health, interest to do anything else after that. Or you get so tired from work or stressed out that when you finish work, you just literally want to do something that's, a little bit unhealthy, like sit around and watch TV. So the brain health aspect, is related to work, and then of course, sleep impacts brain health and social interactions. Albert talked about a little bit about loneliness, social connections, that impacts how our brain functions, and cognitive functioning. And the good news is there is now, sort of a network of organizations that are interested, employers that are interested in brain health and are working to better assess that. And then specifically for this audience, health workers. Earlier it was mentioned the Impact Wellbeing Initiative at NIOSH. Health workers, I'm going to tell you this, the slide is there if you want actual data of the difference in health workers before and after the pandemic. This study was published, I guess it was last year. Health workers experienced more days of poor mental health, reported an increase in feeling burnout very often, it reported an increase in harassment at work, and reported an increase in feeling burnout in 2022, and were very, very likely to want to look for a new job. That is specific to the healthcare sector. I included that, but you could get similar data for other jobs and industries, which is part of what we do in occupational safety and health. We ask clients, the patients, what job do you do and how does that impact your well-being? And now we're going to turn around. That's all sort of pessimistic. And that's a very low bar, right? Traditionally, in occupational safety and health, what's our goal? We don't want people to get injured or sick. That's a very low bar. Think about what the World Health Organization definition of health is. It's not just lack of illness, it's actually health. So let's turn that around and apply it to the workplace. How can our jobs help us contribute to our well-being? So that is very ambitious. We're not just saying, don't have people, make sure people don't leave their shifts, don't go home sicker than they were. We actually are questioning, how can we help people become healthier? And there is more attention to that now, which is great, as Albert said. The previous Surgeon General had this short paper, I like it because it's very short, 2 or 3 page paper on the value of work well-being and how it impacts employers. It's good because a lot of times we talk to employers who are not researchers, who are not reading all the scientific journals. They're just like, tell me something simple, something I can do now, get to the point, and that's a very easy to read paper. And of course, the current Surgeon General has a report on mental health, as Albert said, but he's done other things. He also had a report on social isolation and loneliness. He had a report on youth mental health, and that does apply to the workplace, because certainly there are young workers in the workplace. And he recently released a report on parents and family interactions, and that obviously applies to the workplace. Now we'll say more about total work health. I'm gonna pause and see how many of you know what total work health is? Okay, all right. This is a simple graphic. It's just showing that there's the bedrock of what we do, which is keep people safe, but then we want to add to that and also contribute to their well-being. The definition of total work health is very long. I'll just break it up into a few things. It's policy, programs, and practices. And I point out that practices means the unwritten things. Policies and programs are all the written policies and procedures. But we know in real life that what's written isn't what always happens. So practices, and it's all workplace policies and practices that could impact worker well-being. So that includes obviously occupational medicine, industrial hygiene, safety, engineering, but also things like HR policies, risk management, diversity, equity, inclusion, everything. It is similar to other models that you could know from public health, the health in all policies. in public health or in community health, health and health policies refers to, when you're in a community, you want to make sure there's healthy walking trails, you want healthy, access to foods, you don't want people to have a food desert, you don't just want, fast food, healthy transportation options, and you can apply that to the workplace. So in the workplace, is there access to healthy foods? In the workplace, are there options for exercise? In the workplace, are there, if you're talking about health and health policies, educational policies, is there equitable training and development opportunities? Or the socio-ecological model, which is simply saying that you don't live and work in a vacuum. You're part of this whole ecosystem. So working upstream, these organizational interventions, like Albert said, and of course the social determinants of health. And again, we could apply the social determinants of health to the workplace. Social determinants of health includes things like socioeconomic status, housing, you can see the nice neighborhoods, not so nice neighborhoods. You can apply that to the workplace. Socioeconomic status at work. Socioeconomic status is because of work and how much you get paid. And if you want to look at your environment at the workplace, you can see the people with a nice window, offices, sunlit, and the people in little cubicles who don't have any privacy, no space to call their own. You can apply that model right there in the workplace. And root cause analysis, that in systems engineering, that's sort of taking this very integrated approach. If there's been an incident, you analyze it, you say, well, why did this happen? Well, they weren't concentrating, they weren't paying attention. Sure, you could say more training is needed, but you could do a deep dive. What was going on? Is there something distracting them? What could be, is there a problem with a supervisor? Is there something going on at home? Really getting to the root cause of it. And cognitive ergonomics talks about the cognitive load functioning. And macroeconomics is really the system, how everything works together, and of course systems engineering. So you see it's similar to many different approaches in terms of really focusing upstream at the organizational level. And these ideas are good when you're trying to reach out to other disciplines and say, this is similar to things that in your field, we are literally talking about the same thing. I'm going to put this down so I can get some water. A few years ago, the National Academies of Science created an action collaborative on this, again, specifically for this room, on clinician well-being and resilience. I really like that in 2019, just before the pandemic, they released a report really saying you need to take a systems approach. So for healthcare worker burnout, it's not sufficient to just tell someone, go home and meditate, go home and take a break. You really need to see what is going on at work. So the model they had, has obviously team members and then the organization, what's the culture there, what's the supervisors like, and then outside of that, all the things in healthcare, in the American healthcare system, billing, paperwork, all those things. So to just sort of put the responsibility on the worker saying, you need to deal with your own health stuff is not going to be a good way of addressing these problems. And in total health, we apply the hierarchy of controls model. Since this is an occupational safety and health room, I'm going to ask how many of you know the occupational safety and health model, the hierarchy of controls model? Okay, basically it's saying you really want to work upstream at the primary prevention level. So if the concern is asbestos, the best way to not have asbestos-related disease is to not use asbestos. And then you have engineering control, substitution, but at some point you sort of have no choice. The asbestos cleanup workers, you give them personal protective equipment. Firefighters, you can't tell them don't go running into a burning building. For healthcare providers, you have to work shifts, that is how it is. So as part of the hierarchy of controls, you do have individual level interventions, that is part of it. But that should not be the whole focus and probably not a priority. As we all learned during the pandemic, personal protective equipment is not easy to do in terms of compliance. So you really want to work upstream and make changes at the policy level for everyone at the same time versus trying to change behavior one person at a time. And we all know how difficult that is. Here's an example. I'll give a couple of examples of this multi-pronged approach. One is we're dealing with substance use and mental health. First, you need trust and communication. I think there was a question earlier about, how do you do some of these things? It's not something you could just snap your fingers and say, right now we're going to implement a smoking cessation program or something. No, it takes a long time. It takes commitment, resources. Trust and communication isn't something you can just do immediately. But the good thing is it is free. So if, they're like, I don't have the funds to invest in these systems. Well, having trust and communication is low cost. And have safe work, right? If people are overworked, they're more likely to get injured, potentially be prescribed painkillers, potentially have mental health concerns. Safe work, good organizational level intervention, have supportive policies and benefits so that people could get the care they need, so they have the flex time to go and get the medical care they need for those who don't have an on-site health clinic. And then, of course, individual health education. So you see this multi-pronged approach and how you could be more efficient if you work upstream. Another example is for sleep and fatigue. Again, you need to have safe staffing. If there's not enough staffing and people have to take on more shifts, that's not going to be good for their sleep health. A few years ago, I read that, I think it was in Fairfax, Virginia, the firefighters were working so much overtime, but they sort of liked it because they wanted the extra pay. They were making like $200,000 or $300,000 a year because they were so short staffed. But what does that do for their sleep and fatigue? And it has to help support the policies, as was discussed earlier, so you don't have to check email or text. You check your phone at night and on the weekends. But you see how that is upstream. That's a culture change. That's not something that an individual worker can just say, I'm not going to check my phone now. No, they don't have the authority to do that. These are organizational decisions. Maybe have a place where people can take a break. But again, the practices, the culture, what is it really like in real life? Ariana Huffington told us one time at the Huffington Post, she had a couch in her office and she would take naps and she would encourage her workers to take breaks when they needed it. And the one day she realized, she should leave her curtains open when she does that so that they could see that she's taking a nap and feel like they could do the same thing. Otherwise, sure, you've got on paper saying you can take a break if you need to. There's even this nap room, you could use it, but if you don't see people actually doing it, if you don't see leadership doing it, you're not gonna feel comfortable doing it. Another example was actually the CDC director, previously. He would go on vacation on bicycling trips with his son. And one time he came back and wrote an email to all of CDC. You have to take a word for it because I don't have the email. I search and don't have the email, but I didn't imagine it. And he said when he came back, he almost forgot his login ID. And he was telling us this to give us permission to truly disconnect. He said, I had a wonderful time. I disconnected so much. I could barely remember my login ID. And he was sending an email to all CDC so that we could do that. And think of what that means for me. So if I want to take a break and not check email, I could say, hey, look, the CDC director didn't do it. If he didn't do it, I don't have to either. And sleep education, back to sleep. So this multi-pronged approach. So there's the individual education, sleep hygiene, don't drink coffee, turn off your phones, all those things we know. But then the upstream things to really make it easier for people are important. Just a quick summary of what total work health is and is not, in case it's not clear enough. It is about work organization and the job itself. All the things that Albert talked about, that is it. There's no part of what I'm saying that's really telling the worker, you're fully responsible for this. It needs to be voluntary and participatory. We certainly don't want to force workers to do anything, and have data privacy protection so that people feel comfortable discussing any concerns they have. Remember the trust and communications. Total work health is absolutely not a blaming the worker. We're not saying, well, if only you had, if you only had better mental health, that would have been a problem. It is not about discrimination, and there is sort of a fine line with this, now a lot of health insurance, programs have like a discount for if you quit tobacco, or if you improve your metrics, there's a discount. But at some point, if you're a very low wage worker, and the discount is like $600, which they can have up to, that's a common thing. That almost seems a little unfair for people who really need that money. But anyways, in general, not about being discriminatory, and hopefully it's very clear that we're not talking about wellness or health promotion program, so that is part of it. This is a slide to look at leisure. There's a lot of things in there, many of the things that Albert talked about, but beyond that, also other policies, human resource policies, things questioning technology, just different ideas for issues that relate to worker safety, health, and well-being. The orange is what I call buckets, different categories, and then within that, there's many other issues. And this list, as long as it is, still is not exhaustive. It's just a good way to sort of get your creative juices going when you're really to sort of think beyond the traditional interventions. I've talked about worker well-being a lot. A few years ago, we realized there was no widely accepted definition for worker well-being. So NIOSH worked with the RAND Corporation and developed a framework for worker well-being. I'll go through a little bit just to think through again these topics. There are 5 domains, the 4 in color, and the 5th one is in gray, home, and society. The first domain, physical environment and safety climate, that includes all the things we usually think of, the traditional NIOSH and occupational safety and health concerns. That is the bedrock. We do need to make it clear that employers need to have this in place. If workers are being injured, then they're not mentally gonna be wanting to talk about other things. You need to have the safety in place. And it does include the psychosocial work environment. It includes things like discrimination, bullying, sexual harassment, physical violence. Second domain of worker well-being is workplace policies and culture. This includes access to health benefits, access to other types of benefits, the culture for supporting health at work, and it touches on some things that Albert talked about, designing healthy jobs. Do people feel like their job is stimulating? Do they feel confident in it? Do they have control over it? What are the social interactions like? And are the demands appropriate? And that is, again, something that only organizations can control, right? Third domain is worker evaluation experience. This is the sort of the subjective part of worker well-being. There's the objective part, the part that's, all the social determinants of health. We have decades of data showing things like socioeconomic status matter for health. So that's objective. But there's the subjective things too. Things that are important to you may not be important to someone else. Things that influence your health may not quite so much matter for someone else. So this is asking workers, when you're thinking about going to work, what kind of emotions come up? Do you feel anxious? Do you feel excited? Do you feel like your work is meaningful? All of that relates to worker well-being. I'll say one thing, there is, as Albert said, there is training that's evidence-based, training that can be used to train supervisors. And they found that supervisors who've been through this training, afterwards their workers reported better sleep, better health outcomes, greater job satisfaction. And other things such as for related to supervisors, if a worker feels like their job is insecure, but they have support from their workers, from their supervisors, their engagement level doesn't decrease quite as much as it would generally when they feel like their job is insecure. Similarly, if workers feel like they can use their skills at work, they're going to be more engaged and have better health. So those are things that impact how workers feel about their job. Fourth domain is health status. That's all the things you think about related to individual health, sleep, sleepiness, functioning, in injury at work and how it affects you. Did you have to miss work because of that? And again, we're not blaming workers for having any chronic health conditions. We are really trying to see how can our jobs support them in their own health. And home, community, and society. That is because we know that workers don't live and work in a vacuum. We're hopefully part of this whole ecosystem. Hopefully we're not working so much that we're not part of this whole ecosystem. And that was actually part of the Surgeon General's in particular interest in mental health and social connection. He said when he was Surgeon General the first time, he was working so much, and when he finished, he realized he had lost a lot of his friends because he was so busy working, he didn't keep in touch. And now he was like, having to call them up and say, remember me, and say, want to be friends with you, even though I sort of, I'm sorry, and he did, that is what he said, like he was feeling disconnected because he had been working so much, and that is why, one of the reasons why he suddenly realized, social connection is very important. And specifically for employers, in an occupational health setting, family members matter because employers are paying for the healthcare maybe of the dependents. Our economists have found there are a few interesting studies. One is that when a worker has been injured, the family members within a few months of that are more likely to be hospitalized and or to have musculoskeletal disease. And the converse of that is true. If a family member had a hospitalization within a few months of that, the worker is more likely to have an injury. So it is connected. And family life satisfaction, one study found workers who reported greater life satisfaction were less likely to have a workplace-related injury. And overall life, do you feel like you can make ends meet? Do you feel like you have emotional social support? Do you have time to do the activities you're interested in? All of that impacts worker well-being. As I said, we developed a survey tool based on this framework. It's free for public use, so I'm not selling anything. We're the government, everything's free. It's a free tool on our webpage. You're invited to use it, and Hero, which is sort of a consulting firm, they now have an online platform so you can administer the survey. And it can be used by employers, by researchers to understand the well-being of the workforce. You could use it, now and then take it again later to track changes, do interventions, compare the well-being across different working groups, link it to other types of data, healthcare data, turnover data, safety and health management system data, and it should be really useful. I've said a lot. I'll summarize with a few, one summary and then a few resources. Key essential elements of total work health. One, you need leadership support, and that's leadership commitment at all levels, not just the top C-suite, not just headquarters, but the frontline supervisors. As you experience in your daily life, it's one thing for someone, the top leadership, to say something, but who really impacts your happiness and your actual functioning every day at work? Your frontline supervisor. More so than the big, CEO of the hospital, your actual chief. And second essential element is the bedrock, protecting workers. Thirdly, keep workers engaged, really ask workers what's important to you. Question came up earlier, what do we do? Albert doesn't have the answers, I don't have the answers, the workers ask them, they know the answers. And that's true for you, you're a worker. You are in the workplace, you see your problem, you're like, this is what they should do. There's no one solution. Ask the workers for protect their privacy. When you do it and integrate systems, the things I've been talking about isn't just something that is mostly not what physicians and healthcare providers could do. It's really reaching beyond that and everyone working together. We have a lot of resources on our webpage. Even with these 2 hours between me and Albert, there's still a lot more information I could share. We have resources on workplace supported recovery from substance misuse. We now have a cannabis page, and it's all based on this model of working upstream and creating safe and healthy cultures. We have training. The one on the right is the supervisor training I was talking about by one of our centers of excellence in Oregon. The one on the right is one of the health impact well-being resources that was mentioned earlier. There's free online training for preventing burnout for public health workers. All that is free on our webpage. And then earlier there was also the question of, how do you link this to other metrics? And I think that's very key, because if you are just focused on worker safety and health, that's great. That's the four A's, the quadruple A's, right? The triple aim is, environment and economics. And the fourth one is healthcare workers themselves. And the key is we need to incorporate worker safety and health into the organizational mission, so that you don't have, here's one metric. Our goal is we want to, in the case of healthcare workers, we want to have the healthiest patients. That is usually the goal of healthcare organization. But if you leave out worker safety and health of the actual workers in the organization, that's not going to help you reach your goal of healthier patients. So all the goals need to be working together, and worker safety and health needs to be part of the mission, not a side thing, but literally acknowledged as part of the mission. Like if you're creating a car, you want the best equipment, the best supplies. And that is sort of what workers are doing. Workers are the asset, and they need to be healthiest. So the National Safety Council has a great document sort of talking about how these are all linked together. They compare total work health to ESG. I just would say that it is sort of the same. To get ESG, you need total worker safety, total worker health. And of course, human resources. This is just an example I talked about of how you can bring about change. Paid time off, you got it on paper. How many of you use up all the vacation time you're allotted? Okay, so that means, just to confirm, there are many of you who are not using up all the vacation time you're allotted, right? And then, of course, when you're on vacation, are you checking your email? Right, so the difference between policy and practice. So there's different, ideas, maybe before a big rush period, really encourage people to use the paid time off. There's one organization that they've talked about, including that in the goals, back to linking into the goals. Yes, sure, your patient safety is good, but what percentage of your workers actually use up all their vacation time? Is that the metric that's being looked at? And then, of course, really encouraging people to have flexibility, to give workers flexibility and control. Another quick, simple document for the non-researchers, that is, the managers, the people who are like, this is great, what do I do? Mental Health America has a short little document on how to be more supportive of workers if you're a manager. We fund 10 centers of excellence across the country, one of which is Johns Hopkins. Very, very happy to have them. All besides NIOSH, all the centers of excellence have great resources. The Hopkins Center focuses on mental health, so you're at a great place if you want to learn about that. We also have an affiliate network that recognizes nonprofit and government organizations that are interested in total worker health. There's no funding involved in either direction. You don't give us funds, we don't give you funds, but it's a network to learn from each other. It includes all the people you like: ACOM, AOHN, AIJ, ASSP, NSC, the Society for Occupational Health Professionals. The conference that Albert said, it is coming up in June of next year. Albert and I are in the planning committee, so it'll be great. It'll be in Washington. But for those of you who are local, literally here, Total Work Health has a symposium itself, and that symposium will be in October on the NIH campus in Bethesda. So if you want a good conference without traveling, there's that. The affiliates all have excellent resources too. AIJ has resources on total work health, ASSP, ACOMS talk about total work health at their annual conference tracks. That is it. I will end with this slide, just what I hope our jobs will all be like. Thanks for me. Thank you. Yes.
Yeah. That was actually, I had a scenario where I was working with an HR professional, and we were talking like, see, they built a gym to improve the health and well-being of the worker, and then And then, the workers' conference room says, take Jim out. And because they were getting so much work-related injuries from the gym, so it's like a catch-20.
Yeah, you're right, and that is why you sort of need everybody working together. In case people didn't hear it, the question was, an organization having a gym and workers' compensation, why does take the gym out, because there are too many injuries. You're totally right, and that's why you need to have everybody working together, and that is sort of what creates the silos and the problems, right? One place is saying, well, you need to do this, and another one's like, but that affects what we do. So you do need to have the collaboration at the top level. And that's an example where that didn't happen. And I totally imagine that there would be a solution other than taking the whole thing out, but literally trying to figure out, making people sign a waiver or something. But yeah, that is definitely a very common concern. And that relates to the question earlier, sure, we care about worker safety and health. We also want to be productive, and we really need to be responsive to patients and give them, the best care they can be. So therefore, the workers need to sacrifice themselves. No, everything should be theoretically working together and reach a nice balance.
Other questions? Thank you, Chia-Chia.